Hi, I'm Dr. Hoffman.
Mark.
Mark, what brings you in today?
Having some low back pain.
Low back pain?
Yep.
And when did this low back pain start?
About a month ago.
1 month ago? And what happened, or tell me about...
So I was just kind of doing some landscaping, and I bent over to pull a root out of the ground, and then I just kind of strained my back when I was pulling it out.
So did you have any pain before this, or is it a chronic issue, or...
This is a new
issue?
Yeah.
So started 1 month ago. If you could rate it at the time of the injury, how would you rate it?
At the time it was pretty painful, like 6 out of 10.
6 out of 10?
Yeah.
And if you could rate it right now?
Right now it's like a 3 out of 10.
And at its worst?
At its worst would probably have been that time 6 out of 10.
6 out of 10?
Yeah. And best would probably be like 1 out of 10.
1 out of 10. So has the pain been coming and going? Has it been constant?
Pretty constant.
Okay. Have you been taking anything to make it better or worse? Is there any...
I've done a little bit of icing that day, and then that week, and then taking some Advil.
Okay.
Yeah.
Have you seen anyone for this?
No.
Okay. Any history of fractures to the area or anything in the past? You've had injuries to the back in the past?
I've kind of beat on my back a little bit with just wrestling and then dirt biking and snowboarding, other action sports.
Okay. And then if you could describe it, what would you say? And you said low back and...
Yeah, it's like dull, but definitely just, I guess I don't know how to explain it.
Okay.
Yeah, sore in the morning.
Sore in the morning. Is it worse in the morning?
Yes.
And then does it radiate anywhere to your legs, to your arms, or?
No, it pretty much stays in that low back area.
Okay. A couple questions. Do you have any abdominal pain with this? No abdominal pain? What about any type of flank pain, so pain on the side right here?
I suppose it's kind of just some muscle pain because I've kind of cheated to this side.
Okay. On the left side then?
Yeah, I guess. I don't know, it kind of just hurts to stretch the opposing way of the back pain.
Okay.
Yeah.
And then any urinary symptoms? So you frequency going too much, or anything change with your patterns?
No, everything has been normal on that end.
Is there anything that you specifically do with activities that may have makes the pain worse after this injury a month ago? Any type of
Just
activities you do at home?
continuing work, I guess, kind of aggravates it.
So positioning and or stressing it makes it worse?
Laying on my stomach when I sleep has been making it worse.
Just a couple other questions. So does the pain, do you have any pain that doesn't change with movement?
It's, if I cheat to that side, then the pain goes away. But bending over and standing back up kind of makes it flare up.
Okay. Does the pain keep you up at night?
No, I usually will take Advil before I go to bed.
Okay.
And then I don't wake up until the morning, then it's sore again.
And what dosage of Advil have you been, or do you usually take on a
It's
daily basis?
2 150, so 300 milligrams, I think.
And a little social, at the house, drinking, how many alcoholic beverages do you have a week?
A week would probably be 3 to 5 beers. And then I do chew tobacco.
Okay. Any illicit drugs or anything like that?
No.
As far as work life, do you do a lot of movement during your work, or
Yeah,
is it
landscaping,
on your...
so it's kind of just manual labor.
Okay, so it's been hard for you to do your work because landscaping.
Mhm.
As far as neuromuscular, do you have any history of fractures in your spine or any
No, the only fracture would be my scaphoid.
scaphoid
Yeah.
in your right hand?
Mhm.
Any increased muscle weakness at all? Easily bruising?
No.
Any history of joint pain, joint swelling?
No, this is like the first time I've kind of had any back pain or back issues.
Sounds good. And neurologically, any headaches or any nausea or vomiting that went with this at all?
No.
No? Okay. That's good. Where we at?
You're at 5 minutes.
Not bad, dude.
Yeah.
I think I skipped, like, I went back and forth a little bit, and I kind of, like, interrupted